Hello everybody, welcome back to the New Hampshire Business Show. My name is Chris Pastrana, and today I'm joined with Elizabeth Gillis from Regain Health and Balance. Welcome to the show.
Thanks for inviting me, Chris.
Thanks. So let's get started. Let's talk a little bit about kind of what got you to where you are right now. A little bit about your business, all that.
Sure. So I ended up getting into natural forms of healthcare due to my own personal health crisis. So as a child, I wasn't the healthiest child. I seemed to catch everything that came along. As I got older, I seemed to get more and more things. I started getting eczema, chronic tonsillitis, all these different things, which weren't anything really major or really serious, but if I knew now, or if I knew then what I know now, then I'd know that those symptoms were indications that there was something going on. And eventually it became something worse. So eventually in the late 1990s, I was diagnosed with rheumatoid arthritis. And of course, just like most people, you have a fever, you take a pill. You have a cold, you take a pill. You have a sore throat, then you get an antibiotic. And that was kind of the protocol of what I went through until I was diagnosed with the rheumatoid arthritis. I was on lots of different medications. Nothing was really working. My rheumatologist decided that he was going to put me on an immune-suppressing drug that was called Plaquenil. But he also informed me that I was going to possibly lose my vision and that I would need to have vision screenings every 6 months. Yep. So that kind of scared me, and that motivated me to kind of look into maybe other approaches to healthcare, and that maybe there was something else that I could do to get myself on a better track. And that was the beginning for me getting into a natural approach to healthcare. So I started with researching herbs and supplements and different things like that to do things that actually worked with my body rather than just masking the symptoms. And so that just progressively turned into me learning how to actually do different things to take care of myself, to take care of people that I knew, family members, friends, and that eventually just broadened my horizons and grew into more and more of an interest and more of a passion to get me to where I am today. So now I'm helping lots of people with lots of different things, anything from stress to very serious health issues.
Okay, so this is a good place to start. So we have, kind of talking about the difference between Eastern and Western medicine, kind of right there. So let's get a little bit into that, just very briefly, because we know what Western medicine is.
Right.
We live in New England, where it all started.
Right, and that's kind of considered the conventional approach to healthcare,
yeah.
Right? So the way that looks is you have a symptom and you go to the doctors complaining about all the problems that you have. But just really quickly, I want to talk about that the symptom is not really the problem. The symptom is an indication that there's a problem and there's an imbalance in the body. It's just the body's way of expressing and trying to get your attention. Mm-hmm. So when you go for a conventional approach to healthcare, which is Western medicine, our physicians and whatnot that we're used to going to, we go and we tell them our list of symptoms, and they check off boxes and say, based on the symptoms that you have, I think that this is your diagnosis, and then this is what we do for that diagnosis. So whether it's surgery or whether it's a prescription medication, and that's what they do to try and help you. So that's just masking the symptom. They're not asking or trying to figure out why you're having this symptom. They're not asking you, how much are you resting? How much are you sleeping? What is your diet like? How stressed are you? They're not asking you those kind of questions. So the Western medicine is great for short-term fixes. It's to get you out of a rough patch, but it really wasn't meant to be a long-term approach as far as prescription medication goes. And it seems in this day and age, the more prescriptions you're on, the more prescriptions you're going to have to be on, because then you need another prescription to take care of the symptom that you're getting from the other prescription, yeah. Right? So you can see how this goes. The Eastern approach to medicine, or like Chinese medicine, they're much more interested in finding out what not only the underlying causes are, but where are imbalances in the body. They're really interested in the relationships of what's going on in different parts of the body and how things are working together, or where there's imbalances, where there's blockages, and addressing those imbalances and those blockages in order to address the symptom on its own organically.
Okay.
Does that answer your question?
Yeah, I think I just wanted the audience to have an idea what we're talking about when we're talking about Eastern and Western medicine. All right, so I kind of played around with your website a little bit, look at everything.
Okay.
There's a whole lot on there.
There is.
So let's talk about Bodytalk. Is it
Yes.
Bodytalk? So
the Bodytalk healthcare system,
yeah.
yes. So I started learning Bodytalk in 2012. I had been trained in some other modalities, and they were great, but they weren't giving the results that I was looking for. And there was other components to healing that I knew that were out there. So when I discovered Bodytalk, that was really the piece de resistance for me. That is kind of the golden egg for state-of-the-art energy medicine is what Bodytalk is often referred to as. And it is just juicy bits and parts of various modern and ancient healing methods integrated into one system. So you have Western medicine, so we're addressing organs, endocrines, body parts. But you also have the perspective of Eastern medicine, lots of Chinese medicine, Ayurvedic medicine, ancient Hatha yoga, all these different things. You've got osteopathic philosophies, you've got science and physics integrated into it. So everything that we do in the Bodytalk healthcare system is backed by science. Mm-hmm. And it gives a much more holistic approach because we can look at so many different things that are going on with a person, between body chemistry and addressing intolerances and allergies and microbes, viruses and different things like that, to emotional things, traumas. We can address things in Chinese medicine like the meridians and balance meridians and do chakra balancing and all these different things that are just huge components in creating these formulas of what's going on in your health, in regards to your health and your current state of health of what's going on right now. So Bodytalk is a priority-based system, which means that out of everything that's going on with you right now, which is usually a lot, we boil it down and we stop, and with Bodytalk we can narrow it down and say what's the most important thing for us to address right now at this point in time. And when you communicate with the body, and we have this extensive protocol chart that we navigate, that's a huge map of the whole body-mind complex. And we use a form of muscle testing, applied kinesiology, to test and communicate with the body itself, to have it give us answers as to what we need to address. What parts and pieces do we need to look at? What different criteria, what are the underlying factors, what are the root causes that are causing you to experience a symptom, rather than addressing the symptom itself. Because if you're addressing all of the things that are factors in contributing to your symptoms, and you address those, then guess what happens to your symptom? Your symptom goes away. So we can address so many things without actually addressing the source of the symptom. Mm-hmm. So I've had clients that have had shoulder pain, not address the shoulder pain, address the root causes behind the shoulder pain and have the shoulder pain disappear. Mm-hmm. I've had people, come in with stress, immune issues, all kinds of different neurological problems, and been able to address things without addressing what seemingly seems to be the problem or the symptom. Mm-hmm. So it's really a unique approach to healthcare because you're looking at the whole person. You're looking at physical, you're looking at emotional, you're looking at biochemical all simultaneously.
Yeah, I totally get that too. Like, I have a lot of health problems from when I was in the military, and yeah, I have a lot of things that stretch from my hip to my back to my neck, all stemming from problems with my knee. So if you fix that, everything else kind of helps alleviate itself.
Absolutely, because everything's connected, right? The elbow connects to the wrist bone and all that kind of stuff, and that's the big part of Chinese medicine. Absolutely, everything in the body is connected. So if you start taking apart bits and pieces, which is the Caucasian, or the Cartesian model, Caucasian, yeah. That was a fun one. The Cartesian model, where you're looking at things, parts and pieces, you're forgetting that everything's interrelated. So that's the big part of Bodytalk, is absolutely everything's related. And even if it doesn't seem like we're addressing your symptom directly, we are addressing it indirectly.
Okay. Yeah, I can definitely see that. So what's a session look like? I can only imagine, because we're going to have a lot of viewers that can look at it and be like, I know what it's like to go to a doctor. That's easy.
Yeah, this is nothing like going to a doctor.
And they're going to be afraid and scared and stuff. So
first of all, I don't wear a white lab coat. So I will be dressed something like what I'm wearing today. And I have a beautiful treatment room. And you come and you lay down on a comfy massage table. You sit up on it for a while. We chat a little bit. If it's the first time you've been in, you do have an extensive intake form that you have to fill out. And we go over that and we review it. We discuss, what your issues are and what you want to get out of coming in for a treatment. And then you simply lay down, and I calibrate your body for giving yes/no responses and use it as a human lie detector test, essentially, and navigate this protocol chart. and say, okay, what is it that we need to work on? Oh, we have to work on the liver today. And what with the liver do we need to work on specifically? Is there a part, is there a function? Is it the quality of the liver in Chinese medicine that we have to work on, right? It's about organization, it's about getting things moving, it's about all these different things other than just the physiological Western medicine function of what it does. And we find all these bits and pieces, and maybe there's anger in the liver, or there's unprocessed emotions that turn into chemicals that store themselves in the tissues of the body that create tension and like a torque within the body that kind of throw everything off. All kinds of different things come up, and it's not up to me using education or guesses as to what it is that I need to work on. And that's what's so beautiful about this system, is it's completely customized to each individual, and your body is telling me what it needs and wants, and the order in which it wants it. So when you're actually honoring what the body wants, you get lasting results. So when we complete a treatment, that treatment's all done. We store it in the body-mind so it doesn't get forgotten, and the next time you come back, we do a whole new series. So it builds upon things each time. So when you come in, you lay down, we get you ready for the yes, no answers, and you just relax. And I'm just kind of playing around with your wrist a little bit, and once in a while, if you fall asleep, I might have to wake you up. I might have to have you, do different hand positions, or I might have to have you have exaggerated breathing, or there's different things that sometimes my clients have to participate in. But for the most part, it's very, very relaxing. There's some tapping that goes on. After I get all the bits and pieces of what we call formulas, so it's like a mathematical equation, but using words and body parts. After I get that information, then I do a gentle tapping over the head while the client has nice full breath, do a tapping over the heart and over the belly. The head is to engage the brain and get the brain's attention, to pay attention to the formula that I have revealed of what needs to be addressed. And it gives the brain a homework assignment and says, you need to go and take care of these things. You need to do whatever upgrades on these systems are required, make any corrections to anything that's not working properly, and take care of all of these things. And the heart is kind of like hitting the save button on your computer so that it gets stored in the body mind and the brain does not forget what it needs to do. It doesn't run off and try and do something else in the meantime. And then we also engage the enteric brain, because there's a lot of things that go on with the enteric brain or the gut brain that is involved in the healing process as well.
Okay, there's a lot there.
Yeah.
So first thing I'm going to say is as I mentioned earlier, like when you think of Western medicine, you kind of have to think of New England is where it all started. Mm-hmm. So I remember in one of your interviews you had talked about it just hasn't quite caught on here as well. And that's probably why you're seeing that a lot, is New England's very tight with old medicine.
They are.
So I can definitely, because even based on what I've learned through medicine, which is not much, I'm not a doctor, a lot of it would go against some of these things, or just they're very different. Mm-hmm. So when someone hears this type of stuff, what's a good thing for them to just kind of like deal with it?
One of the things is the Bodytalk healthcare system is very complementary. Yeah. So it works in conjunction with any other treatment that you might be getting. Mm-hmm. So if you're seeing your Western medical doctor, that's fine. So you can do that in addition to this. Mm-hmm. This will be completely supportive in whatever other approaches to healthcare you're receiving. If you're getting physical therapy, you will get results faster. If you're going for talk therapy, counseling, you will get results faster if you're using it in conjunction to Bodytalk. Now you can come in and just get Bodytalk sessions, and we can balance the body and get it working more efficiently so that it does the job that it's supposed to do better and faster. Right? Because the body is meant to take care of itself and run itself smoothly, but we throw kinks in the system that prevent it from doing its job as well as it should be. And that's what we do with the Bodytalk healthcare system, is we come in and we remove those kinks to allow the body to be able to repair itself, to be able to take care of itself. So, for instance, if you have two people who have gone in for the same kind of surgery, one person is healing very, very quickly and the other person is taking a much longer time. Why? They have the same parts and pieces. Right? But there's something that's preventing the other person from healing as efficiently, because it's the body that's going to heal it after the surgery. It's not the surgery that does the healing, right? It's the person that does the healing. Yeah. So we're just setting up the right circumstances so that the body works better and does the job that it's supposed to do, gets reminded of what it's supposed to be doing or what it has forgotten to do, and get it to work better.
Okay. Good answer.
Yeah.
Good. So we've talked about the body. There's a lot that goes on there, but let's talk about the skin and some other things as well. Because when I was looking, you also have the energetic facelifts, things like that.
Yes. So the energetic facelift, that is also known as a life lift. So we are dealing with all kinds of energy circuits within the body to actually help stimulate and bring the facial muscles and the skin back into more of a normal location. So we are energizing the body, and it's also affecting other things. It's affecting people on an emotional level and doing all kinds of other things. We're reprogramming the system again, but it is more for a cosmetic alternative to going in for something that would be as drastic as going in for, injections or whatnot. And after about 20 sessions, it seems to be more of a permanent effect, but it's a nice, gentle, and you can just see the before and afters. People's faces are much brighter. They seem more lifted. Their eyes are brighter. It just has like a really great rejuvenating effect, and it sometimes lifts other parts of the body too, because again, everything's connected, right?
Yeah.
Not always just the face. So yeah, that's a really interesting technique. So it doesn't get at the same things that the Bodytalk healthcare system would get, but that's a very, very relaxing and enjoyable technique, and that has nice physical benefits from it.
Yeah, and I bring that up because, again, the body is connected to your skin.
Absolutely.
So when people don't take care of that, there's issues there too.
Right.
So I like bringing that up too because that's a pretty good
Yep.
one. So the last one I want to talk about was lymphatic drainage.
Yes.
Because that just has a very interesting name.
So I am trained in the Valtheim method of lymphatic drainage, which is the Bodytalk healthcare system version.
Yep.
So there are no contraindications with this one, because normally if you're pregnant or you're maybe being treated for cancer, you can't have lymphatic drainage, okay? But in this system, you can. So our lymphatic system is essentially our toxin disposal system. Okay. And a lot of us spend a lot of time sitting, and we don't get as much movement as we should, so there's a lot of stagnation that happens. So people who have a lot of swelling in their ankles and their lower legs, that's lymph not moving properly, not being able to dispose of toxins and whatnot in their bodies. So you really want to have the health of your lymphatic system running smoothly so that your whole system can work more efficiently as well and eliminate, cells that are no longer healthy, and just help that whole turnover. And that's also the reason why, because the lymphatic system is a slow-moving system, that is why it takes about 2 weeks for medications to actually take full effect, because it's actually plugging the whole lymphatic system before you get the full effect of the medication. So that's why it takes 2 weeks. Yeah.
Okay.
So
That's
yeah.
pretty
So
cool.
if that's not moving, it's kind of like flushing your toilet without water. It's not really
Yeah, it
going to
doesn't
go
quite
anywhere.
do what it's supposed to do.
Yeah. It's very important to have a healthy lymphatic system.
That's pretty good.
Yeah.
Well, thank you so much for being
You're
on the
very
show.
welcome.
It feels like we could talk about this for hours, so I'll have to
I know I
bring
can.
you on again so we can get a little more in depth on some of this stuff. But it's very
absolutely.
interesting. I liked it.
I'm glad you enjoyed it.
Okay, well,
I
thank
enjoyed
you
it
so
too.
much.
Thanks a lot.
Okay. Thank you guys so much for watching. Until next week.